4. Suctioning of amniotic fluids. When the doctor reaches the uterus, you may hear suctioning. After cutting through the uterus, the amniotic fluid will be suctioned away to make a bit more room in the uterus for the doctor's hands or instruments such as forceps or a vacuum extractor, which are sometimes used, forceps less often than vacuum extractor but more often neither, to facilitate the extraction of the baby. 5. Delivery of baby's head as born. Your baby is often engaged in the pelvis, usually head down, but perhaps rear first or breech. Whatever part has entered the pelvis will be lifted out by the doctors. You may feel pressure at this point and some women report feeling nauseated during this intense, but brief moment. 6. Although you may feel pressure, you should not feel pain. Once the head is out, your doctor will suction the baby's nose and mouth for fluids. In a vaginal birth, these are squeezed out by the constriction of labor. In a cesarean birth, the baby needs some extra help getting rid of these fluids. If meconium, the baby's first bowel movement, is present, there may be extra suctioning required. 6. Delivery of baby's head and shoulders. Once your baby has been well suctioned, the doctor will start to help the rest of the body be born. The surgeon will need to maneuver the baby back and forth to help them emerge. You may feel this wiggling, but again, while you may experience sensations of tugging or pulling, this should not be painful. They will check for umbilical cord entanglement or other complications as the body is born. You may also have the assistant surgeon pressing on the upper part of your abdomen of fundus to assist in the birth.